I think being at Valor and being a provider or physician, the model of the PAC team is very evident that it works very, very well. And I think it's in the commercial world, many providers work by themselves. They may have an MA, they may have a nurse, but that's it. They don't have the extended family and the extended team to really focus on the patient's needs. And I think that's just a unique perspective that I wish I had when I was working as even as an ER physician, or I'm sure my husband would, as a family medicine physician, would love to have in his practice now. It's just the way we've got it set up, and it's just, that's our nature to have that PAC team alignment. So I think that's the very unique part about working in the C-Box. And then, of course, our patients are veterans, so they're very easy to serve. It's very easy to get behind the mission, and these people deserve the best care.
I think all of that is spot on. I think if I were talking to physicians or physician assistants, nurse practitioners about coming to work at Valor Healthcare, what would be the selling points? And I think certainly the mission is one of them. Look, healthcare is hard. Mm-hmm. It was hard before COVID. It's hard after COVID. And with the shortage in primary care providers, particularly in the United States, and that challenge getting worse, not better, primary care providers are going to be highly recruited, mm-hmm. and the recruiting environment is going to become more and more competitive. So how do we solve for that? Well, I think certainly one of the things that we'll have to do to reach the patients, whether it's in the public sector or the private sector, is leverage technology. Mm-hmm. Telemedicine and AI and all the things that we've talked about before. But why Valor Healthcare specifically? Certainly number one is the mission. And we have lots of veterans who work at Valor Healthcare. We have more employees at Valor who are family members or spouses or sons or daughters or whatever of veterans. And so it is really easy to get behind the mission at Valor Healthcare. But selfishly, what I talk to physicians and nurse practitioners and PAs a lot about when they're trying to decide about coming to Valor Healthcare, as I said earlier, practicing medicine is hard today. The very cool thing about jobs in our company is something that you don't see in medicine very much, which is our clinics are open 8:30 to 5, some of them 8:30 to 4:30. Mm-hmm. There are no nights, there are no weekends. We are closed on all federal holidays. Yes. And I've made the joke many times, when I was in private practice, I couldn't even tell you what month Columbus Day was in. But we all know now, because we work with the federal government, and the federal government is closed on Columbus Day. And so if you are a physician, nurse practitioner, physician assistant, and you have a family, or you have hobbies that you like to devote your spare time to, this is a perfect and really cool job for you, because we work very hard when we are in the clinics Monday through Friday, but no nights, no call, and no weekends. And oh, by the way, there are 10 federal holidays now. Might be 11.
11.
With Juneteenth.
Yes.
So 11 federal holidays now. And that is a pretty nice lifestyle for a primary care provider.
Absolutely.